Doctors won't tell you this. After a certain age, some life-saving surgeries can actually do the opposite. Sounds shocking, right? What if I told you that procedures called routine are quietly putting seniors at serious risk, and most people agree to them without even questioning? Before you or your loved ones say yes in the hospital, there are 5 surgeries you need to think about twice. This could change a life. As we grow older, the body changes in ways that are not always visible from the outside, but deeply affect how we respond to medical treatments, especially surgery. What once felt like a simple, manageable procedure in younger years can become a serious and life-altering risk in later life. Many seniors and their families approach surgery with hope and trust, believing that modern medicine can fix almost anything. While medical advancements have indeed saved countless lives, it is equally important to understand that age introduces a completely different level of vulnerability that cannot be ignored. One of the most significant hidden risks lies in how the aging body handles anesthesia. For younger individuals, anesthesia is generally safe and wears off smoothly, but for seniors, it can lead to confusion, memory problems, and even long-term cognitive decline. Some older adults experience a condition similar to delirium after surgery, where they may feel disoriented, forget familiar faces, or struggle to regain their mental clarity for weeks or even months. This is not something most people are warned about in advance, yet it can drastically change a person's quality of life. In addition to cognitive risks, the immune system weakens with age, making it harder for the body to fight off infections. A surgery that involves even a small incision can become a gateway for bacteria, leading to complications that require prolonged hospital stays or additional treatments. What starts as a planned procedure can quickly turn into a cycle of medical issues, each one weakening the body further. Recovery is no longer just about healing a wound. It becomes a battle for overall stability. Another critical factor is the reduced ability of organs to handle stress. The heart, lungs, and kidneys do not function with the same strength and efficiency as they once did. During surgery, the body undergoes significant stress, and these organs are pushed to their limits. For seniors, this can result in complications such as heart strain, breathing difficulties, or kidney problems. Even if the surgery itself is technically successful, the strain on the body can lead to new health issues that were not present before. Mobility is another area where hidden risks appear. After surgery, many seniors are required to stay in bed or limit movement for a period of time. While this may seem like a normal part of recovery, it can have serious consequences for older adults. Prolonged immobility increases the risk of blood clots, muscle loss, and a decline in physical strength. In some cases, seniors never fully regain their previous level of independence, turning what was meant to improve their life into a cause of long-term dependence. Emotional and psychological effects are often overlooked but equally important. The experience of undergoing surgery, staying in a hospital, and dealing with a slow recovery can lead to anxiety, depression, and a sense of helplessness. Seniors may feel a loss of control over their own lives, especially if they become dependent on others for daily activities. This emotional burden can slow down physical recovery and reduce overall well-being. What makes these risks even more concerning is that they are not always clearly communicated. Many medical discussions focus on the success rate of the procedure itself, rather than the full picture of recovery and long-term impact. Seniors and their families may hear that a surgery is necessary or routine, without fully understanding how age changes the equation. This gap in communication can lead to decisions that are made with incomplete information. It is essential to shift the mindset from simply asking, "Will this surgery fix the problem?" to a more thoughtful question. What will this surgery truly cost me in terms of my overall health, independence, and quality of life? This deeper level of awareness allows seniors to make decisions that are not only medically informed, but also personally meaningful. In the end, understanding these hidden risks is not about creating fear, but about encouraging careful and informed choices that protect both life and its quality. What many people don't realize is that the word routine in medicine can be very misleading, especially when it comes to older adults. A procedure that doctors perform regularly does not automatically mean it is safe for every age group. For seniors, the body does not respond in the same predictable way, and what is considered simple for one person can become a serious health challenge for another. Yet, the label routine surgery often creates a false sense of comfort, leading many older individuals to agree without fully questioning the real risks involved. Take, for example, common procedures like joint replacements or minor abdominal surgeries. These are often presented as standard solutions with high success rates. However, those statistics are usually based on a wide range of patients, including younger and healthier individuals. Seniors, particularly those with existing conditions like diabetes, high blood pressure, or heart disease, face a very different reality. Their bodies are already managing multiple stresses, and adding surgery into the mix can push them beyond their limits. One of the biggest concerns is how quickly complications can arise, even in so-called minor procedures. A small infection, which might be easily treated in a younger person, can become severe in an older adult. Healing takes longer, and the body's response to medication is less predictable. This means that something as simple as a delayed recovery can turn into a prolonged hospital stay, increasing the risk of further complications like hospital-acquired infections or weakness due to inactivity. Another overlooked issue is the impact on mobility. Many routine surgeries require a period of rest or limited movement afterward. For seniors, even a short time of reduced activity can lead to muscle loss and decreased balance. This increases the risk of falls, which are one of the leading causes of serious injury in older adults. A person who walked into the hospital independently may leave needing assistance, not because the surgery failed, but because the recovery process weakened them. There is also the question of pain management. After surgery, pain is expected and medications are prescribed to manage it. However, seniors often react differently to these medications. Strong painkillers can cause dizziness, confusion, or even increase the risk of falls. In some cases, they may interfere with other medications the person is already taking, creating a complex and potentially dangerous situation. This delicate balance is rarely discussed in depth before the surgery is approved. Cognitive health is another area where routine procedures can have unexpected consequences. Even minor surgeries can trigger confusion or memory issues in older adults, particularly in the days following the procedure. This can be frightening not only for the patient, but also for their family. In some cases, these effects are temporary, but in others, they can last much longer and significantly impact daily life. What was meant to improve physical health can end up affecting mental clarity and independence. The emotional side of recovery is just as important. Seniors may feel pressured to agree to surgery because it is presented as the best option or because they trust their doctor's recommendation without question. However, they may not fully understand what the recovery process will demand from them physically and emotionally. Feelings of fear, regret, or frustration can arise if the outcome does not meet their expectations. This emotional stress can slow healing and reduce overall satisfaction with the decision. Another key point is that routine does not mean necessary. In many cases, there are alternative approaches that may be safer for seniors, such as physical therapy, medication, or lifestyle adjustments. These options might take longer to show results, but they often carry fewer risks. Unfortunately, they are sometimes overlooked in favor of quicker surgical solutions. It becomes clear that the term routine should never replace careful evaluation. Seniors and their families must look beyond the label and ask deeper questions about how the procedure will affect their specific situation. Every individual is different, and age plays a crucial role in determining outcomes. In the end, just because a surgery is common does not mean it is harmless, and understanding this difference can prevent decisions that may lead to unnecessary suffering. When it comes to major medical decisions, especially in later life, not all surgeries carry the same level of risk. Some procedures place an extraordinary amount of stress on the aging body, and while they may be presented as necessary or life-saving, they often come with outcomes that are far more complicated than expected. This is why it becomes essential to pause and carefully examine certain high-risk surgeries that seniors should never agree to without deep thought, multiple opinions, and a clear understanding of the consequences. One of the most concerning categories is major heart surgery. While it can be life-saving in some cases, it is also one of the most physically demanding procedures the body can endure. For seniors, the recovery process can be long and uncertain. The heart may be repaired, but the overall strength of the body may decline. Many older adults experience fatigue, reduced mobility, or complications that require ongoing medical care. The question that must always be asked is not just whether the surgery can be done, but whether the body can truly recover afterward. Spinal surgeries are another area of serious concern. These procedures are often recommended to relieve chronic pain or improve mobility, but for seniors, they can sometimes lead to the opposite outcome. The spine is a delicate and complex structure, and surgery does not always guarantee relief. In fact, some older patients experience increased pain, nerve complications, or limited movement after the procedure. Recovery can take months, and in some cases, the expected improvement never fully materializes. Hip surgeries, especially after fractures, are commonly performed in older adults, but they carry their own set of risks. While the intention is to restore movement, the reality is that many seniors struggle to regain their previous level of independence. The combination of surgery, hospitalization, and reduced mobility can lead to muscle loss and weakness. In some cases, this marks the beginning of a long-term decline rather than a full recovery. It becomes crucial to weigh whether the procedure will truly restore quality of life or simply prolong discomfort. Aggressive cancer-related surgeries also deserve careful consideration. In younger patients, these procedures may offer a strong chance of recovery, but in seniors, the situation is often more complex. The body may not tolerate the stress of surgery, and the recovery process can be overwhelming. Additionally, the benefits of such surgeries may be limited depending on the stage of the illness. For some older adults, less invasive treatments or palliative care may provide a better balance between comfort and longevity. Emergency abdominal surgeries are another high-risk category that often leaves little time for decision-making. These procedures are usually performed under urgent conditions, which increases the risk even further. Seniors undergoing emergency surgery face higher chances of complications, longer hospital stays, and a more difficult recovery. The body is not given time to prepare, and the stress of the situation can lead to outcomes that are far from ideal. What connects all of these surgeries is not just their complexity, but the way they interact with the aging process. The body's ability to heal, adapt, and regain strength is significantly reduced. This means that even if the surgery is technically successful, the overall impact on the person's life may not be positive. Independence, mobility, and mental clarity can all be affected, sometimes permanently. Another important aspect to consider is the expectation versus reality. Many seniors agree to these procedures with the hope of returning to a normal, active life. However, the outcome may involve ongoing therapy, dependence on others, or a reduced ability to perform daily tasks. This gap between expectation and reality can lead to frustration and emotional distress. It is also worth noting that saying no to a high-risk surgery is not the same as giving up. In many cases, it is a decision to prioritize comfort, stability, and quality of life. There are often alternative approaches that may not promise a complete cure, but can offer a safer and more manageable path forward. The key is to slow down the decision-making process whenever possible. Ask questions, seek second opinions, and involve trusted family members in the discussion. Understanding the full picture allows seniors to make choices that align with their values and long-term well-being. In the end, recognizing these high-risk surgeries is not about fear, but about awareness, because the right decision is not always the most aggressive one, but the one that protects both life and its quality. One of the most overlooked aspects when seniors consider surgery is not whether the procedure can be done, but what life will actually look like afterward. Too often, the focus is placed entirely on fixing a medical problem, while the deeper question of how that decision will affect daily living, independence, and overall happiness is pushed aside. For older adults, this question becomes even more important, because the goal is not just to live longer, but to live well. Many surgeries are labeled as successful from a medical standpoint, yet the patient's experience tells a very different story. A procedure may correct an issue inside the body, but leave the individual struggling with pain, weakness, or limited mobility. For a senior who once valued independence, even small changes, like needing help to walk, dress, or perform daily tasks, can feel like a major loss. This shift can be emotionally difficult and may lead to frustration, sadness, or a sense of losing control over one's own life. Mobility plays a central role in quality of life, and surgery can significantly affect it in ways that are not always fully explained beforehand. Recovery often involves long periods of rest, rehabilitation, and gradual rebuilding of strength. For younger individuals, this process may be challenging but manageable. For seniors, however, it can become a turning point. Muscles weaken quickly with inactivity, balance may decline, and the risk of falls increases. In some cases, a person who was previously active may never fully regain their former level of movement. Pain is another factor that can deeply influence life after surgery. While the expectation is often that surgery will relieve discomfort, this is not always guaranteed. Some seniors continue to experience chronic pain even after the procedure, and managing that pain can require ongoing medication. These medications, while helpful, can come with side effects such as drowsiness, confusion, or reduced alertness. This creates a cycle where the treatment for one problem leads to new challenges that affect daily functioning. Independence is closely tied to both physical and mental well-being. When a senior becomes more dependent on family members or caregivers after surgery, it can change the dynamics of their relationships. While support from loved ones is valuable, relying on others for basic needs can sometimes lead to feelings of guilt or helplessness. This emotional weight is often underestimated, but can have a real impact on recovery and overall satisfaction with the decision. Cognitive health is another area where quality of life can be affected. As mentioned earlier, some seniors experience confusion or memory issues after surgery, especially when anesthesia is involved. Even temporary changes in mental clarity can disrupt routines and reduce confidence. In cases where these effects last longer, they can interfere with a person's ability to live independently and enjoy daily activities. There is also the emotional side of expectations. Many seniors agree to surgery believing it will restore their life to how it once was. When the outcome does not match those expectations, it can lead to disappointment and regret. This is why it is so important to have honest and realistic conversations before making a decision. Understanding that surgery may improve a condition but not completely restore previous abilities can help set a more balanced perspective. Another key consideration is time. Recovery from surgery in older age is rarely quick. It may take weeks or even months of rehabilitation, follow-up appointments, and adjustments to new limitations. During this time, life may feel restricted and the ability to enjoy normal activities may be reduced. For seniors, time is especially valuable, and spending a large portion of it in recovery must be carefully weighed against the potential benefits. Quality of life also includes the ability to engage in meaningful activities, spending time with family, participating in hobbies, or simply enjoying daily routines. If a surgery limits these experiences instead of enhancing them, then its true value must be questioned. The goal should always be to support a life that feels fulfilling, not just medically stable. In the end, the decision to undergo surgery should never be based solely on the possibility of fixing a physical issue. It must include a thoughtful consideration of how life will feel afterward, because preserving independence, comfort, and dignity is often far more important than pursuing a solution that may come at too high a cost point. One of the most powerful yet often underestimated steps a senior can take before agreeing to any surgery is simply to pause and seek another opinion. In many cases, the first recommendation a patient hears feels final, especially when it comes from a trusted doctor. There is a natural tendency to believe that the suggested procedure is the only path forward. However, medicine is not always one-dimensional, and different doctors can have very different perspectives on the same condition. Taking the time to explore those perspectives can open the door to safer and more suitable options. For seniors, this step becomes even more important because their health situation is usually more complex. They may already be managing multiple conditions, taking several medications, and dealing with a body that does not recover as easily as it once did. A surgeon may focus on fixing a specific issue, while another medical professional might look at the bigger picture and question whether surgery is truly the best choice. This broader view can make a significant difference in the final decision. Seeking a second opinion is not about doubting a doctor's expertise. It is about protecting your own well-being. In fact, many good doctors encourage it, especially for major procedures. A second or even third opinion can confirm whether the surgery is truly necessary, whether the risks are manageable, and whether there are alternative approaches that were not initially discussed. Sometimes, patients discover that what was presented as urgent can actually be delayed or managed in other ways. Alternative treatments are often overlooked, yet they can be highly effective, particularly for seniors. Options such as physical therapy, targeted exercises, medication adjustments, or minimally invasive procedures can sometimes provide relief without exposing the body to the full stress of surgery. While these approaches may require more patience and consistency, they